My name is Carlton Hall, and I am the president and CEO of Carlton Hall Consulting. Uh, we've had more than 30 years in the field of prevention and public health, serving communities all across the country, working with federal leadership across the country for the last more than a decade, and helping communities to implement and execute prevention strategies and strategies just to address addiction and substance misuse across our country. I've had the great privilege of working with some of the leading thinkers and practitioners across the nation, and now focusing on bringing those lessons learned to bear for communities across the country. It is our great privilege to work with the Department of Behavioral Health and Intellectual Disability Services in Philadelphia to bring this conversation with you. I am so excited to be able to have the opportunity for you all to be introduced to a wonderful resource that may not be being utilized as and accessed as much as we hope. And so this is really an opportunity for us to pause and introduce this remarkable resource to those of you who are doing remarkable work there in the city of brotherly love and sisterly affection, as I love to say. So welcome again. I am so very pleased and honored to have this relationship with DBHIDS to help build a capacity for prevention providers there in the city of Philadelphia. And it is a remarkable honor to work with LaVon White and Michelle. You know, Michelle, it's always hard after you got married and the whole nine. Michelle Ramsey. So those of you who are on this line, you all know Michelle, so I know that for a fact. But I wanted to go ahead and extend an opportunity for LaVon to provide our welcome from his leadership to those of you who are here. So thank you all so much. LaVon, please, floor is yours.
Okay. Good morning, all. Good morning, all. Happy Friday, Monday. Every day is a Monday. Every day is a Monday. Really like to welcome you on behalf of Carlton Hall Consulting, Philadelphia Department of Behavioral Health and Intellectual Disabilities for our community engagement series. This is a day that we hope it is fruitful and engaging to all. And I actually want to leave you with a saying that I woke up this morning thinking it stays on my mind daily. If service is beyond you, leadership is beneath you. Excuse me for saying that backwards. If service is beneath you, leadership is beyond you. Wow. Just like you all take what you can hear, spread it, and let's talk about changing the conversation. This is an important topic. We've had a lot that occurred within the last 30 days, and let's see which direction we can go in. The direction we plan on going in, regardless, we just please stay together in whatever we do. I want to thank you again, Carlton, and thank everybody for being on board. Have a beautiful day.
LaVon, thank you, sir, very much, sir, for those words of inspiration and encouragement. And everyone, this is going to be an informal conversation today, really. We are going to take the opportunity to have this conversation. What I would encourage everyone to do, if you wouldn't mind, is to understand that part of what it is that we are here to discuss, here to talk about, is the development of our workforce and resources that are being provided for that, the development of access to support in our treatment areas, and even in, for those of you who work to support mental health and mental well-being across the city. This is really a conversation about a remarkable resource that will help you with all of the things that you all are doing in this regard. And so I am so very grateful. There is a saying that I know we have in our communities that you can't solve a problem unless you can first see that problem. And part of what it is that we are here to do is provide a different kind of a look, hopefully have a different kind of conversation for this. And if you give me just one moment, hold on a second. Sorry about that. You guys, if everybody can make sure that they are muted, that is terrific. Sorry about that. I'm doing a one-man show here. I usually have my producer with me, and he wasn't able to be on this with me, so I'm doing triple duty here. So it is my esteemed pleasure to be able to introduce some remarkable champions in our field that we have the wonderful privilege of working with. And I'm going to allow them to further introduce themselves, but they are from the Donya Institute, which is one of the premier technical assistance institutions in our region. They will explore and explain further their relationship to this resource called the Technology Transfer Centers for Prevention, for Addiction, and for Mental Health in just a moment. But it is my great privilege to have both Deborah Nixon Hughes, who is the coordinator, the project director for the Prevention Technology Transfer Center, but also the person that oversees the entire operation. It is my esteemed privilege to be able to have here Renata Henry, who oversees the Donya Institute and the 3 institutions. Renata has had more than 35 years experience in the field of behavioral health, serving in clinical and administrative positions and community-based mental health. She most recently, before taking on the leadership of Donya, was the Deputy Secretary for Behavioral Health and Disabilities in the Maryland Department of Health and Mental Hygiene, where she was responsible for developing and leading integrated systems for policy development, planning, and services for mental health, substance use, and developmental disability administrations. She is a remarkable leader in our field, and I am so grateful to be able to share. Not merely is she a champion, but she's also a wonderful friend to us. She has some nice connections and roots to our city. And with that, I'm going to stop sharing my screen, and I'm going to ask Renata, if you wouldn't mind. Debbie, I know you are here, may not be able to stay with us for long. So if there are things that you'd like to share as well, please feel free to do so. And if you don't mind, I'm going to unmute you, ask you to unmute, and you can go ahead and please feel free to introduce yourself, Debbie, before I bring Renata on for our presentation, a major part of our presentation. Debbie, are you there? You have to unmute.
Well, I'll just jump in. She may not be able to unmute.
That's fine. Renata, thank you so much.
Okay, not a problem, not a problem.
Oh, here she is. Here she is.
Okay.
That's fine. Go ahead, Debbie. Are you there? Are you available?
Yeah, I was just saying I'm not going to be able to participate, and thanks for having me here.
Okay.
Renata will be able to do everything. I am sitting in a doctor's office with a
don't
mask,
worry.
so I'm sure you guys don't want to see me sitting here with this mask on. So anyway, thank you, Renata, and Carlton will take good care of you. And Carlton promised that he would introduce me to all of you at a subsequent time. Thank you.
Debbie, thank you so much. Thank you so much. Renata, Debbie, I'm going to pull up your screen.
I'm here. Debbie, thank you. And once we finish with the presentation, just know that if you would like to engage with the Prevention Technology Transfer Center, Deborah Nixon Hughes is the director of that center, and she will be your contact person. But if you can't reach her, you can always reach me. So, Carlton, thank you so much. I have love for Philadelphia. That's where I started my career in behavioral health many, many years ago. I don't even talk about how many years ago, but in North Philadelphia, in a community mental health center there. So I love Philadelphia. So we're going to talk a little bit today about the Donya Institute and the resource that can be for all of you. We're housed in Silver Spring, Maryland. We have 3 of the training and technical assistance centers that SAMHSA funds. We have prevention, we have addiction, and we have mental health. But today we're going to primarily focus on the prevention, but certainly if you need the resources of the addiction and mental health, they are there for you as well. Next slide. This is the leadership team. I'm the executive director and project director, and Holly Ireland runs the addiction. She's the co-director of the ATTC. Oscar Morgan is the project director of the MHTTC, and Debbie Nixon Hughes is the project director of the Prevention Technology Transfer Center. And there's always someone in the office that without that person, you couldn't do your work. And Tamara Paris is our director of operations, and she makes the show run. So that's the leadership team at Donya. Next slide. As you've heard, these are the 3 TTCs that we have. ATTC, mental health, and prevention. We're going to focus on prevention today, but know that all 3 of those TTCs are available as a resource to you. Next slide. So, people say, well, what is technology transfer? Next slide. Some years and years ago at the Institutes of Health, this model was developed along with SAMHSA. It's a multidimensional process that intentionally promotes the use of an innovation. So you think about some of the practices that we use, like motivational interviewing. When that was some years ago, when that was researched and developed, and then it became a promising practice, and now it is an innovation that most of us use in the work that we do. So technology transfer is a fancy way of saying it intentionally promotes the use of an innovation, the use of an evidence-based practice, because we all know we want to use evidence-based practices, not practices that are based on our ideology and what we believe, but practices that have and support the evidence. Next slide. So the TTC network goes across the entire nation. There are 10 regional centers that are aligned with HHS regions 1 through 10. Each TTC network, the addiction, mental health, and prevention, includes these centers, 3 of these centers. And again, for HHS Region 3, we house the ATTC, MHTTC, and PTTC, and we're very, very excited about having that ability for this region. Next slide. This is Region 3. For those of you that may not know, but these are the states that we serve in the District of Columbia. And so as we go through this, think about what are the top 3 training and TA needs that you may have for your organization that we can help you address, and certainly going through the Philadelphia city to reach out to us, or you can reach out to us directly. Next slide. One of the things that we really, really believe in is that when you do your work, we do our work, language and the words that we use, words have power. So we always put people first in the work that we do. And using affirming language to promote the promise of recovery by always advancing what we know as evidence-based and culturally informed practices. I'm always amazed at sometimes when I hear people talk about behavioral health or addiction treatment, some of the words that we use to describe what we do are very negative. And I will be the first to admit that there were days that I used those words. So we talk about substance abuse. Well, in and of itself, abuse is just a negative connotation. It's a substance use disorder. We talk about how substance use and addiction are like any other illness, but the way we talk about it, we don't talk about it like any other illness. So the ATTCs and the TTCs really believe that words have power. So let's begin to think about the words that we use as we talk about the work that we do. Okay, next slide. The other thing that we believe very strongly in, I still go back to the days when they were calling it cultural competence, but it is now kind of morphed into cultural humility. But no matter the words that you use to describe it, we really need to understand that individuals grow up in a culture, they're molded and they're shaped by that culture. So as we do our work in treatment, we have to acknowledge that culture, embrace that culture, and practice cultural humility. Next slide. So in all the work we do, we do take a public health approach. We look at it from promotion, health promotion, prevention, early intervention, treatment, and recovery. And we work with multiple health and public health agencies and programs. We truly believe and embrace that there are no silos in the public health system, even though I know that sometimes we may not feel that there are no silos, but we work really hard to try and eliminate silos, do a lot of joint planning, encourage partnerships, because if you work in a silo, then you're going to treat in a silo. So many of you that are on this call and listening to this, I know you work across multiple systems to do what to serve your clientele. So public health approach we strongly believe in. Next slide. And when you think about the consumers and clients that we serve, and then think about the public health system. Look at the multiple entities that the consumers and clients that we serve are often engaged in. So that's why we take this public health approach, a no siloed approach, because we know that the consumers and clients that we serve are often involved in multiple systems. Next slide. This is what we do. This is what we told SAMHSA we would do. I'm not going to read it word for word, but you can see evidence-based practices. We want to strengthen awareness. We want to foster, and this one is really important, regional and national alliances among culturally diverse practitioners, researchers, policymakers, funders, and the recovery community. And we also want to ensure that the work that we do is available to you, and it's publicly available, free of charge, to the behavioral health and mental health field. Next slide. So when you talk about training and technical assistance, this is what we offer: skill-based training. If somebody wants to go deeper, targeted and intensive technical assistance, we've done multiple learning collaboratives, bringing in multiple entities in a community or a system. We have a lot of online courses, toolkits, we do virtual meetings, and a lot of technology-driven models. So that's the kind of TA that we offer. Next slide. So let's talk a little bit about the 3 TTCs. We'll start with the ATTC. Next slide. The purpose of the ATTC is to unify science, education, and service to transform the lives through using evidence-based and promising treatment and recovery practices in a recovery-oriented system of care. You see the focus on science, education, and evidence-based practices. We don't operate on an ideology, but really base the work that we do in the science. Next slide. The Addiction Technology Transfer Center, these are our focus areas, but by no means the only things that we do, but cultural competence. We get a lot of requests for training in the evidence-based practices like motivational interviewing, clinical supervision, SBIRT, medication-assisted treatment. The opioid epidemic took a lot of all of our time, but as we all know, that epidemic is morphing into a methamphetamine epidemic. So we also are bringing that in the mix. The peer workforce, which has grown significantly over the years. So we focus on working with them. And still the most abused substance out there is tobacco. So we do some work in tobacco cessation. Next slide. These are just some of our partners that we work with in the region. And you can see that these partners kind of go across the behavioral health and public health system. We know the relationship between substance use and HIV and infectious disease. So you see we work with the AIDS Education Regional Training Center, Johns Hopkins Center for Substance Use Treatment, Mid-Atlantic has a large collaborative in HHS Region 3 with other public health programs. We have an affiliation with Morgan State University on their School of Social Work and helping them turn out social workers and graduate social workers that understand the behavioral health system. And the University of Maryland does our planning and evaluation. Next slide. Talk a little bit about the MH, the Mental Health Training and TA Center. Next slide. This is the purpose. Again, the lines are not rigid between addiction, mental illness, and prevention. The purpose of the MHTTC is to strengthen the skills and knowledge of the behavioral health and primary care workforce that provide services to children, youth, adults, and who have or are at risk of serious mental illness and co-occurring substance use disorders. And I know all of us know that it is rare when someone comes with just a substance use disorder or just a mental health issue. Co-occurring disorders are common. Next slide. These are some of the areas that the mental health TTC focuses on. We know that suicide rates are rising, particularly in African-American communities and young African-American men. So we do a lot of work in the area of suicide prevention. Mental Health Center looks a lot at the evidence-based practices in prevention of mental illness, treatment, and recovery, cultural and linguistic competencies, smoking cessation. You know, our populations that we work with, and all of you know this, smoking is still a real issue. So we, and particularly with people with severe mental illness, so smoking cessation, we do a lot of work, again, in system integration, and the implementation of evidence-based mental health school-based services. And I know that in Philadelphia, there's a lot of work going on in the school system around mental health and trying to prevent and support children with mental health issues. Next slide. These are some of the partners that we have for the mental health TTC. I'm not going to read those off, but just for your edification, you can see that. Next slide. Now talk a little bit about the Prevention Technology Transfer Center that Debbie Nixon Hughes is the director of. Next slide. We believe strongly that the prevention is, an ounce of prevention is truly worth a pound of cure. And even though it's an old saying, that is the kind of the foundation of the Prevention Technology Transfer Center. Next slide. And we use as a basis for the work that we do, many of you are familiar with SAMHSA's Strategic Prevention Framework. This is a planning process that offers the prevention professionals that are out there a guide to address substance misuse and the related behavioral health problems facing their communities. So it's not just about treatment, it is also very much about prevention. Next slide. So the Prevention Technology Transfer Center, their purpose really looks to develop and disseminate tools and strategies that improve the quality of substance use prevention efforts. We provide a lot of intensive technical assistance and learning resources to professionals, organizations, and others in the prevention community in order to help improve their understanding of prevention science and improve program and client outcomes. So that's the prevention side. And Debbie Nixon-Hughes is the director of the PTTC. Next slide. So the PTTC uses a lot of epidemiological data to guide their planning that they do in prevention. So, you know, West Philadelphia, if you were doing some prevention programs in West Philadelphia, it may look very different in what you may do in Northeast Philadelphia or South Philadelphia. So we look at a lot of epi data on the prevention side and see, you know, what promising practice and evidence-based practices we need to use. But if you step back and think about mental illness and substance use disorders, we all want to get better at the prevention work that we do to try and help prevent people from heading in that direction. The PTTC also develops tools and resources to engage the next generation of prevention professionals. I can remember back in the day when it was all about treatment, but prevention has a huge role to play in what we do. Next slide. So the PTTC focuses on engaging and collaborating. We chose to work with primary care providers, and that's just not the only group that we work with, but we know that physicians in primary care are really a critical piece of helping parents and children and teenagers. They can talk about prevention and the dangers of substance use. So we engage with a lot of primary care providers around substance use prevention. And I would look for, that's an area I'd really look forward to in the city of Philadelphia doing more work. Next slide. Again, these are our partners that we work with. On the prevention side, we have subcontracts with them to help us with that. Next slide. So this is just an example, a really short example of some of the projects that we have. The ATTC is working with Maryland primary care doctors on SBIRT, get the physicians getting better on SBIRT. We work with Title X, that's family planning, to help family planning agencies get better at screening and brief intervention around mental health and substance use. We do this, what's new is something that all of the HHS agencies in Region 3, we work collaboratively because again, the individuals we serve show up in multiple systems of care in the public health spectrum. The mental health TTC, coming soon, we're going to do some work in provider self-care and we'll get a manual around self-care out. School-based mental health, I could do a whole presentation on school-based mental health. We all know the stresses that our children are under in schools, so a lot of work in schools. Workforce recruitment and learning retention collaborative. And the PTTC does a lot of regional webinars on overdose prevention, suicide prevention, smoking cessation, and identifying and addressing emerging trends in the behavioral health substance use world in terms of trying to get on top of that and prevent. Next slide. So that comes to the end of our presentation. We wanted to introduce to you those resources that are available to all of you in the city of Philadelphia. You can reach out to us one-on-one. I know that we do work with the city of Philadelphia through the Office of, Behavioral Health and Intellectual Disabilities. But we are available. It is a resource that all of you as providers can reach out to us and use. And we really, really look forward to hearing from you and getting a sense of, before, as we close, if you have technical assistance needs, please make those known to us in the time that we have left here. And Debbie just reminded me, Debbie Nixon-Hughes just reminded me, this is an opportunity to share with us what some of your needs may be. And with that, I will stop and take any questions. I'll unmute myself and take any questions that anyone may have.
Fantastic. And folks, if you don't mind, we're going to kind of do this in a certain way. First and foremost, could you all help thank Renata for a great presentation? If you all know how to do the hand clap thing and the thumbs up thing and all of those little things that we now have to do in this new virtual reality to show our appreciation and express our appreciation, I wanted to do that. I also wanted to thank you personally, Renata, for introducing this remarkable and wonderful resource, because the fact of the matter is that the technical transfer centers, or the technology transfer centers, are indeed the way SAMHSA, the Substance Abuse and Mental Health Services Administration, want to provide training and technical assistance delivery throughout the country. You are actually the access point, the liaison between all of the providers that are here and that federal resource from SAMHSA. Is that an appropriate way of stating it? And if you would you want to add to that?
No, Carlton, absolutely. We're encouraged by SAMHSA, funded by SAMHSA, but also, you know, encouraged to reach out to communities, to cities, to states, to counties, to say, this is free training to you, free training to the behavioral health workforce.
That was the word that I was waiting for.
Waiting to hear.
Right.
Right.
So, if you say that word again, what costs are involved with accessing your resources?
Free. F-R-E-E, free. So it is free. It is, like I said, we're funded by SAMHSA. SAMHSA has expanded. Historically, it was just the Addiction Technology Transfer Center. And in the last 3 years, they added the other 2 centers. And so it is a free resource to all of the entities that work in, and I'll say public health spectrum. Even though we focus on behavioral health, we know that FQHCs, that HIV, STI, STD programs see people with substance use disorders. So as we have grown, we've also kind of spread out and said, look, we know that people with substance use disorders, mental health issues show up in multiple public health systems.
Yeah. So. Absolutely. And so, folks, here's what we're going to do for the next few moments that we have together. We really wanted to provide an opportunity for you all to be introduced to this resource, but to be able to bring your questions, ask your questions, if you wouldn't mind. As you were beginning to think about that, what we're going to do is, if you have a question, you can raise your hand, and then I will, please turn your camera on, and I will tell you who can unmute, and you'll be able to ask the question. As you're thinking about what questions you might have, I would like to take the opportunity, because I'm really grateful and glad I see them. I see you see them, Renata. So,
yep.
I would like to take the opportunity to have our friend and the leader in our city, who's really accountable for ensuring that these types of services are provided to you all, Mr. Roland Lamb, to be able to share his remarks, and maybe you have a question for Miss Renata Henry. I'm not sure, but maybe you do. It's good to see you, Roland. Welcome, please.
Good morning, good morning, good morning. I am playing hooky from another meeting just to be here because of my good friend Renata is speaking this morning, and I needed just to stop in and say good morning to her and tell her how grateful I am that she still is, supporting what we're doing here in Philadelphia, and has been really a blessing and a resource to the system itself. And I just want to thank her, thank Donya, for their support of what's going on in Philadelphia, as well as thanking you, Carlton, and my folks here in Philadelphia, Devan, Michelle and company, and John Carlson. Thank you for being the host of this. I really want to, give a shout out to you, TTR. But the really important thing is this: the community is the linchpin of all of this. We need to make sure that we are investing and continuing to invest in the communities. It is where these problems, are festering and where the solutions are going to come from. The city of Philadelphia, unlike probably most major cities in the country, have been invested in building communities that are empowered. It's not us. It's not but the folks who are downtown, the folks who are have titles beside their names. It's the community and the community members and the organizations that exist in the community. And we need to build, continue to build strength and alliances within those communities. So I just want to say, this is an investment. We have to continue to invest. And I want to, again, welcome all of you all. I apologize for not being here this morning, but we have, as been my world of late, I have conflicts with several meetings at the same time. So, I'm going to hang out with you guys for a little bit. And hopefully, if I can be of any assistance as far as answering questions are concerned, I will also be available.
Thank you so much, Roland. And I'm glad you could pop in. And for those of you that are on the call, let me just say that I've seen a lot of city behavioral health agencies, state behavioral health agencies, small places, rural agencies. And I do want to acknowledge Roland's leadership and the years of leadership that he's had in the city of Philadelphia. And you all are very, very lucky to have him. Very lucky.
Thank you.
The struggle continues.
Certain.
All right, John. So listen, folks, thank you so much. So here's what we're going to do. If you have a question, please turn your camera on. If you can indicate by raising of the hand, we're wanting to open that. If you just want to put it in the chat, we will take it from the chat and also read it. But please take advantage of this. This was intended to be more or less a semi-informal kind of conversation with you all, and so there's no pressures with respect to that. But I'm sure that there must be some questions out there related to this. Let me start off by also asking one simple one. Renata, you had indicated that you were talking about the distinctions and the differences between the priorities and the focus for each of your TTCs, right? So if I'm interested in accessing some of the technical assistance training, how would I go about doing that?
So, let me just say that we know that in working with state and federal government, that the concept of bureaus are, is still there. And SAMHSA is a federal agency whom we certainly appreciate. Decided that they have a Center for Substance Abuse Prevention, a Center for Mental Health Treatment, and a Center for Addiction. We all know as practitioners that the lines aren't as rigid as that. So as you think about your technical assistance needs, certainly we will work with you to kind of think about it across the spectrum, across, the public health spectrum. As well as when I say the public health spectrum, we also know that the individuals that we serve have their hands or their feet in many other systems, the primary care system, the child welfare system, you talk about systems, many of the consumers that we serve are in multiple systems. we do a lot of work in cross-system, partnerships, as well as understanding what some of those other systems have to offer. And we've done some work where we've partnered with other entities in other systems, because I think the reality is the work that all of us do engages multiple systems. So I wanted to make that clear. We're funded by SAMHSA, but we all know that the consumers that we see and serve are in multiple systems.
Thank you so much. Phoebe, I see you. Raise your hand. Would you mind? I think I can have you unmute now. Go ahead and unmute yourself.
Hi, good morning. Thank you very much. That was a very informative presentation. I'm Phoebe, I'm with Women in Dialogue, and we run the Crossroads Women's Center in Germantown, and we're also the lead agency for a community collaboration on wellness that's funded by the Department of Behavioral Health, and which has been very useful in getting resources to us. What I wanted to ask was, one of the things we're finding at our center is that domestic violence and abuse seems to be a lot behind this abuse, a substance abuse or whatever term. I mean, when we scratch the surface, we find even, child welfare, criminal justice, substance abuse, it's there. And including one woman in our network whose daughter was a victim of a vicious rape and has been struggling with suicide and addiction ever since. And I wondered if you partner with any groups or if you had any particular suggestions for us on how we can address that most effectively. Thank you.
Thank you, Phoebe. And certainly what we all know is that many of the individuals that we serve are involved in multiple systems. One of the things I learned early on is the idea of bureaus is in this country for a long time. For a long time, we have bureaus, we have agencies, and sometimes they don't play well together. But one of the things that we try very hard to do when we're working with states or cities or jurisdictions is talk about how that our consumers that we serve have their feet in multiple systems, and planning to how do we work effectively across those systems. So we try very hard to, while they're in the behavioral health system, like you say, they have their hands and feet in multiple systems, and how do we, where do we need to work together? Where do we need to ensure that, there's collaboration? So I've learned that early on, that people in the behavioral health system don't stand in a silo. So if you were asking us for some technical assistance, one of the things we would be asking you is what other systems or what other programs, do you want involved, if any at all? Because the reality is our consumers and our clients are in multiple systems. Is that helpful?
Yes, no, I think it is. And I just wondered also, when you listed the groups you partner with, is there like Center on Domestic Violence or something that's?
We do a lot of,
Yeah.
I could start naming what is it, ACF with, child welfare. We've done work in cities and in states where we've, partnered across the systems to get outcomes. Sometimes it's working across multiple systems that we know that the clients that are getting served by the behavioral health or the substance use addiction agency. So we do a lot of work in bringing people to the same table. HHS Region 3 has an interagency group that meets probably quarterly, and we're a part of that. And we always, I try and force I shouldn't say force, but ensure that the conversation is the consumers that we serve in multiple systems, and how do we cut down on some of our barriers. And I'm not saying we abuse confidentiality, but what are the ways that we can work in a coordinated fashion to best serve our consumers? So we do a lot of cross-system. How can we help you work more effectively with ACF, for example? And what are the barriers, and how can we knock those barriers down, or I don't want to say get around them, but really knock them down. Oftentimes it's how do we negotiate those barriers.
Thank you so much.
Yeah.
So, Phoebe, if there's something specific that you're looking for with your partners and your constituents, you know, just reach out to Tamika, myself, Keena, and Levan, and then we can sit down and try to figure something out and
Yeah.
more immediate.
And if
Yeah,
we can
I mean,
ever,
we're just learning this more and more, you know, as people come to us and we like, wow, what's
Yep.
underneath this, you know, and then how do we address it most effectively?
and if we can be of any help in that, please let us know, because we all know in our heart of hearts that the individuals that we serve are in multiple systems. And I think we do a lot of that work in terms of how do we make multiple systems play in the sandbox together. So I'll give you an example. Just the other, we have an ongoing relationship with the the AIDS Education and Training Center and the STI, STD centers. We do a lot of collaborative work because we're serving the same, our systems are serving the same individuals. So, yeah.
I have another question that came in. Just really asking if you wouldn't mind, Renata, to express or expand even more on how folks might be able to access technical assistance. Is there a form or a process that you could speak about? This individual is a part of a clinical think tank and just think that you might be a really wonderful resource, or Daniel might be a wonderful resource with that.
Sure, I will make sure I'll get our, you tell me, Carlton, the best way to get our contact information out to and they can just reach out to us and we will respond to them and talk, sit down and talk with them, what are their needs, develop a plan, who else needs to be engaged in the process, because like I said, it's not just the behavioral health resources, that's what we're funded to do, but we can also help you maybe with a cross-system plan in terms of, do we need to have you engage with child welfare? How do we, so.
Well, I know that this is the beginnings of a wonderful conversation that will continue, and we will work with Levan and Michelle to be able to ensure that everybody has that information, and that we've developed a process for that.
That'll be great, because then that way we can say, okay, for the city of Philadelphia, this is who we're communicating with. This is how we can, respond to that.
We'll
Absolutely.
And we'll work with Debbie to be able to make sure that happens.
Absolutely.
Terrific.
And because we have all three of the TTCs, while we talked to, Debbie's the prevention, we do have the mental health and we do have the addiction. So, we'll respond to the best we can to the needs that the requester has.
Absolutely. There are a couple of things I want to share. Are there any other questions? If you do, please, again, feel free to turn your camera on or simply just raise your hand and I'll make sure that you're called upon. I'll give us a few seconds to be able to do that. If you have any further questions, you can put it into the contact or to the chat. I want to let everybody know that this session has been recorded and Levan and Michelle will receive access to this recording and we'll be able to get that information out to everyone after this session. It'll take a day or so for us to be able to get that information to you, but if you want to look at this. Renata might have said something that you may not have caught the whole thing, and so you might want to go and review that. So we'll be able to provide that for you as well. So if there aren't any further questions, I'm going to do this real quick. Before I go to do that, I'll ask Roland, is there any additional comments or statements that you would want to offer, sir, with respect to this, or what you think might be some of the potential of a continued relationship with the providers here, the practitioners here, and this resource of the TTCs?
Well, I think that the whole, the whole idea of, meeting in this kind of way and providing these resources, is a beginning, but it cannot be driven by us. It can only be facilitated by us. And I think that, on a lot of different levels, I'm hoping that the providers that are appearing here are going to be catalysts to move this conversation forward, bringing other providers together, assembling coalitions of providers in certain areas. I was, really taken by the questions that, Phoebe asked, because of the one thing that we've been complaining about, not complaining about, or I guess you can say stressing about, is the fact that most women who are in addictive careers begin those careers in abusive relationships. And so for us, we still think that women are underserved in our system when it comes to, treating the whole person. When we cover that, that ground and begin to understand, that this is baked in, this is an historical fact, and so we need to begin to think, very differently about what we're doing. I think COVID has also challenged us now to understand that we are never going to be the same again. And if that's the case, then we need to be thinking, proactively about our future and how we're going to move, services in the future, both for prevention, early intervention, treatment, and in long-term recovery. I think that, all of this needs to be a consideration for the folks who are on this call. And we need to make sure that we are all contributing to that message. We don't want to have people from Washington, trying to decide for us. And this is not against people from Washington. It has more to do with the fact that solutions have got to come from communities. I said this earlier, I know I sound like a broken record, but I really am concerned about the fact that we need to get community involvement, community investment, and communities need to become the drivers of this. I really want, folks up from my end of the world to stop trying to drive the bus and get in the back and pay for the gas. And that's where I'm at, and I know that is not necessarily a popular thing, but that's where we are at in Philadelphia. So the bottom line is that the community needs to drive this. Our providers who are in the community need to be a part of this process, and I'm hoping that you guys take advantage of the fact that Donya is like diamonds on the ground. The ATTC is like diamonds on the ground. They're not worth anything as long as you leave them on the ground. You don't pick them up. You got to pick up the diamond, and then the diamond also brings worth to you once you realize what it is. And so I guess my point is that I want you guys in the community, providers, to be gathering up all these diamonds that are available to you and really, challenge us, to improve this system and to walk a different path, in fact, going forward.
Roland, I think the one thing that I really want to underscore that you said, we're in this pandemic now, but people say, oh, well, after it's done, everything will go back to the way it was, and it's not. It will never go backwards. We never go backwards. And so there will be innovations and things that come out of, where we are. So we just need to remember that. So thank you for reminding us of that.
Thank you very much, Roland. I mean, very, very well put. And I think a wonderful segue and summary for what it is that we're sharing. Folks, I just want to offer a reminder. We're about to come to a close. I want to offer a reminder and actually promote and share that we will be coming again with another part of our community engagement series that we are working with on DBHIDS on. This one is really around understanding kind of the opportunities that you all will have to access not merely federal funding, but state level funding, and kind of what do you need to consider? What are some of those capacity needs around that? So it'll be a wonderful conversation. We're going to tailor it to Philly because, you know, we are unique, right? We know who we are. And so we will be able to do that. That will be on December 2nd at 10 o'clock. It says 10:30, but I believe it's at 10 o'clock that we'll be able to do that. I just want to underscore what Roland and Renata indicated. You know, we're living in some remarkable times here. I mean that in every sense of that word, remarkable. And I'm mindful of the fact that Dr. King and reminded us that during these times that he referred to as fiercely urgent times, that is really important for us to understand that need to work with each other, to take advantage of these opportunities, as Roland mentioned, and to look at the fact that we have the solutions. We just need to be mindful of that. This is the time for vigorous and positive action to take place. I want to thank you all because you all are representative of that. Thank you very, very much for your time. Please help me again thank our very, very dear friend, Renata Henry and the Donya Institute for a remarkable presentation. Thank you so very, very much. Levan and Michelle, thank you so very, very much for your leadership that you provided. Of course, Roland, John, Kenya, and the entire team, everyone there that helped to make this happen. Thank you all so very, very much for this. And we and Michelle, are there any last comments or any last thoughts that you have for your folks before we let them go?
I just want to say thank you, everyone, for attending. And there will be, as Carlton shared, we will have additional sessions such as this to help with capacity building within your agency. Ask that when we share the announcement to you, that you share it with other community-based organizations, because, you know, Philly is unique, and we know how to do Philly the best way for Philly to get ahead. So, and we can create just that for you all. So please share the information with others. Thank you and have a great day.
My grandmama said, when there's no more to say, it's best to say no more. God bless everybody. Thank you so much.